Welcome. I want to introduce you to my new practice, Rise Surgical, and today I want to talk a little bit about robotic colon surgery and what an advance that is in the surgical industry. So if you think about it, old-fashioned days, we used to have to make big incisions on your abdomen to do a colon surgery for cancer or infection. In the last 15 years, we've really implemented laparoscopic surgery, which is smaller incisions, but it has the disadvantage that you still have to bring the bowel out through the abdominal wall, sometimes with an incision this big. And some colleagues will even put their fist in the abdomen to move the tissue around. All that manipulation slows down your recovery and impacts healing. But then with the revolution of robotics, it allows for very precise movements in very small incisions. So now our incisions are smaller, they're fewer, and I can dissect and remove the colon and then hook the ends back together inside the abdomen. So I'm not pulling anything out through a larger incision. The connection can be made inside your tummy, so we're not stretching and pulling on nerves. The advantage of that, quicker recovery in the hospital. Your bowels don't go to sleep. You're usually out of the hospital in 2, sometimes 3 days. That translates to a faster recovery and back to work sooner, back to fishing and hunting and all the things that we like to do. Another advantage of robotic surgery is three-dimensional viewing. We can see three-dimensionally, whereas with the old-fashioned laparoscope, it's a two-dimensional screen. Another advantage is we use a fluorescence dye. So as we're cutting out the colon with our instruments, that compromises blood flow. We want to make sure when we put the ends together that it's healthy tissue. The fluorescence dye that I can inject turns all healthy tissue green. You can see that on the screen. So I know exactly which ends to hook together to get the optimal healing, minimizing any complications from your surgery.